Okay, live a little bit early because I hit the button by accident while putting the microphone on. That's okay. We will work with it. So, Dr. Mark Vaughn here. How much early? Just 3 minutes early. He'll forgive me for that. And we even have viewers already, so that's good. And we are ready to talk to you. We actually can start getting comments now because the feed is going through. We can see that on our monitor. And you did see from the picture that we're going to have a PA student join us for the show. We're excited about her coming to join us. Her name is Kara. Hi, Bianca. Yeah, we're glad to have you here. I know that I may have said last week we wouldn't have a show this week or probably wouldn't. Well, we are. We're doing it after all. And also, Amy, hello to you too. We're glad to have you here. Those watching this after the fact, if we do choose to make it available for people afterwards, this is a live program and really is all about the interaction between myself, my guest, and our audience. It may seem a little awkward after the fact, especially if you don't have the feed enabled to see what the comments and questions are, although we do try to, in our answers, have them in context so that you can tell what the question was. Robert Antonio, also one of our regular commenters, is here. Hi, Robert. We're glad to have you here also. And I have an announcement, so make sure I don't forget to tell you who we're going to have as a guest next week. She was on all of the major networks this week, and we've got her publicist booking her with us for next Monday, and we'll talk about that. Dr. Gwain also talked about her in his blog, Dr. Green Knight, earlier this week, today, I guess it was actually. Looking at comments, I have a little place to look at comments here, so it's a little bit easier. How am I? Doing great. Very relaxed and and really enjoying not being in the office right at the moment. So I appreciate you asking. Okay, so would this be a good time for me to introduce our guest? Let me see if she's ready. Are you in the middle of studying? I think she's in the middle of studying because she's a PA student. That's why. I have a place for you where you won't be too short because of the, what's it called? It's not parallax, because of the perspective of the camera here. So let me see if can I adjust the exposure while we're doing YouTube live? I don't know that I can. I'd love to if I could. Okay, so your spot is right here. Careful not to bump this, otherwise the camera goes crazy. And the mic should be able to, this is Kara. Welcome, Kara, to the program.
Thank you.
I was actually telling them to welcome you.
Oh.
So Kara is here. Kara is well, you're right between first year and second, kind of, because you had your white coat ceremony, and that's what that picture that we used for the thumbnail is from. It was from your white coat ceremony. Well, can you tell us a little bit of the significance of the white coat? You're not wearing it now, but...
They told us about the history of it at the ceremony, and it's part of the medical tradition showing transition from being a student to entering the field of medicine as a clinician.
Yeah, which means touching what?
Patients.
People, yeah. Patients. So my medical school didn't have a white coat ceremony, but many do, and I believe they traced it back to, was it Columbia, if I remember correctly? They talked about it at the ceremony. An older medical school in the country kind of started this tradition of recognizing this transition from just being a student, didactics, lectures, classroom, to being a clinician, touching patients, which are people. And so it's a big deal that this, it's a sacred thing, actually, to go from being a student to touching people. It's not like veterinary school where it's somebody's pet. As dear as they are to people, it's different when it's their child, parent, sibling, spouse that you're touching, or the person themselves, for example. It's a person, another person that you're working with. Big deal. Yeah.
Yeah.
So that's a what's the word for it? A milepost?
Milestone.
Milestone. There you go. I don't know what a milestone is. I put them on signs so I can read them as I'm driving by. They're kind of blurred as I go by. No, I don't drive too fast. Usually. You don't know what to say to that. So right now you're still finishing up your very, very last classes. Here you have, 2 weeks left?
2 weeks and then finals.
2 weeks and then finals. And these finals are before you go. Now, do you have like medical students would have some kind of board exam you have to pass to go on to?
Not to
Do
go on to
clinicals?
clinicals,
Okay.
no. The only board exam is at the end of everything. We take the PANTS, the physician.
Take the pants.
Yes,
You,
The-
you put on pants.
in a way.
Okay, pants. Physician assistant.
National certification exam. So it's PANCE, not
Panks.
yes.
Panks instead of pants. Okay, so we have right here Brio saying, hi, nice to see you again. Haven't you seen in months? Hi, you're very, I think she's talking to me, not you. Have you seen Brio in many months?
I don't think I've ever
You don't remember talking to
seen-
Brio?
No.
Brio, thank you. Yes, we're glad to have you join us. Now, you're in the middle of school, so lots of classes, getting ready for clinicals, getting your schedule for clinicals
Yes.
and finding out where you're going and what you're doing. What are the rotations you're going to take?
We have 8 rotations, 2 family medicine, 1 mental health, and then pediatrics, internal medicine, surgery, emergency medicine. Did I already say emergency? I don't think so. And then we get an elective, so I'm doing neurology for my
Neurology?
Elective,
Where are you
yeah.
doing your neurology rotation?
in Anchorage, Alaska.
Okay. So not all in Nashville.
No,
Yeah.
all of them in the Nashville area except for that one.
Except for that one. Wow.
Yeah.
Okay. And which ones would you start with?
I start with internal medicine.
Internal medicine. Okay. And for those of you who don't know, internal medicine is really the bread and butter of what doctors do. It's seeing patients for things that are treated with usually medicine, not surgeries. I'm not sure what it's called, internal medicine, because we give medicines internally. I guess we're not just doing dermatology and applying topicals, although that's part of it. That's part of internal medicine, because it really is anything that goes on with an adult that isn't surgical. And then within internal medicine, there are subspecialties like cardiology, gastroenterology, pulmonary rheumatology. These are all subspecialties of internal medicine. So it's a lot.
Yeah.
I'm getting nervous for you because it is so big. It involves so much. And internal medicine, I didn't mention nephrology, is things that require math and equations sometimes to calculate what's going on, because you're taking numbers from like blood gases or chemistry results and having to figure things out. Sometimes some complicated physiology.
Yeah. Not looking forward to those equations.
Yeah, I don't know how much of it's going to involve those. So let's get caught up with our comments. Oh, I also see Rusty Bernard is here, one of our regulars. And Robert Antonio, why did you choose PA instead of NP? NP short for nurse practitioner. Why was that?
Yeah, that's a good question. I, going into the field of medicine, didn't really know much of a difference between the two. For me, it was mostly just because of my undergrad. They didn't have nursing as an option. And for most nurse practitioner programs, you go from nursing in undergrad to an NP program that's about 2 years typically. But I majored in biology in undergrad, so then it made more sense for me to go to a PA program. So for me, that was the reasoning behind it. But I'm learning that there are more differences in the training between the two, with NP being more of a nursing training, and then PA being more of a medical approach, or there's some term for that. And I'm still not completely sure what the differences between the two are. But then once they're in practice, the roles are pretty much the same, from my understanding.
My understanding is that physician assistant kind of came from the military. Is that
Yes,
where it has its
originally
origins?
it did, yeah.
Whereas a nurse practitioner would have come from a civilian nursing program. Most likely, historically, that's kind of where they came from. One was civilian, one was military. One was somebody with nursing background. The other one was somebody who, well, the military either would have given them undergraduate training or the equivalent courses, or they would have had it before they started the program somehow. So you really do need a full bachelor's degree in science.
Yes.
In order, do you have classmates who didn't have a science bachelor's?
Not that I'm aware of. I know that it's possible as long as you get all the prerequisites, but it's really hard to do that if you don't have a science major.
So you're almost doing a double major if you're not a science major already going into
Yeah.
it. Okay. And then the nurse practitioner, they would come from a nursing program. They'd actually be a registered nurse before starting. Now, our nurse practitioner at the Auburn Medical Group, Megan Mobley, she was not a nurse before she started her program at Vanderbilt right here in Nashville. And she went through and did I think it was a 4-year total, but that was after graduate. No, it wasn't 4-year total, was it? She graduated with a science degree from
UCS.
Santa Barbara,
Yes.
yeah, UCSB. Then got into this program at Vanderbilt where they did what it took to get her from her undergraduate degree to being a nurse, which was shortened because she'd had a lot of science, and then went straight into the nurse practitioner program. We have found that in our office where we train students, we're getting a lot of requests for nurse practitioners to rotate through our office because their schools don't provide them with rotations. Is your school providing you with?
Yes, my school, they set up all of our rotations for us unless we want to do an elective that we set up on our own. So that's why I'm doing one in Alaska. I have a friend who lives there, so I set one up there. But otherwise, they completely set them up for us, which is really nice. That saves a lot of stress of having to call offices and try to find somewhere that will take you.
Yeah, and we don't really get calls from PA students to do rotations in our office because it's not this thing where they have to schedule their own. A lot of nurse practitioner programs, we do get the requests, and so we're seeing that there's kind of a difference. The PA programs have it already in place. They have a place for their students to go, whereas the nurse practitioner programs more so are just kind of sending. Now, I don't mean to accuse all programs of this because obviously we're not getting calls from the ones to even know about them that don't need help, somebody else to do their work for them. But the majority of the calls we get are from nurse practitioner, or almost all nurse practitioner programs. It does make me a little wary of nurse practitioner versus PA because so many of those programs don't have a place for their students. It makes me feel a little bit better about the PA. And I hate to say that as a generalization because there's awesome nurse practitioners, including the one that we have, who, I would hire them. I would have them as my primary provider. They're so good. But as a rule, I feel better about the PA programs going into them. Now, PA, what's it stand for?
It now stands for Physician Associate.
Physician Associate. So Rena, our PA at our office, has said that she can't quite yet start calling herself Physician Associate because something needs to happen at the state level, I believe. But that's been a decision that's been made by AAPA.
AAPA.
Yeah. Our name means something different now. But that's good. I like it because we've actually run into confusion. In our office, we have a position called medical assistant, and this is the person who rooms the patient and takes the initial, chief complaint and writes it down, goes over the medications, and helps with bandages or dressings. Very, very much a part of the hands-on work that goes on in our office. But different from a physician assistant, what is it the physician assistant is going to do?
They'll act as a primary care provider, so seeing their own patients and managing them and prescribing medications, working very similarly to what the doctor does. Okay,
so you walk into the exam room. After the MA has made them ready, the PA will take their history, ask them what's going on, doing the medical interview, do a physical examination, formulate a care plan, and initiate it by ordering labs, imaging, sending in prescriptions because they can prescribe, and then the patient may or may not see the doctor.
Right. Yeah.
So they pretty much do what the doctor's doing, and I guess have the doctor there for backup.
Yes.
If for example, it was to be something more difficult than their comfort level, or which actually, come to think of it, that's what I do. I call Dr. Gwaine when I have a difficult case, and I have him come in and look at what's going on and help me with it. So not too different. Yeah. And then they can be in any specialty?
Yeah, pretty much any specialty. They have, just like doctors can go into residency for a specific specialty. As a PA, you can do a residency as well. especially for things like ICU that's really specific and you need to learn how to use special tools and machines. You can go and do a residency for a year or two after graduating to train you for that. But most people, if they're going into something like family medicine, they typically won't do a residency after
They'll
graduating. Just go straight in.
Work for a doctor, and a lot of those specialties also, up until very recently, and even probably still, they're not really doing a residency. They're just going to, work in an orthopedist office, for example. That's still happening, right?
Mm-hmm.
But
yes.
Residencies are becoming kind of a thing in that field. Let's get caught up with some questions here. Oh, look, Deborah Ronker. She wrote something. I'm a retired nurse. 33 years worked on my master's and my bachelor's and undergraduate, and they did not have PA back then. 33 years ago. 33 years ago, there were PAs 33 years ago, weren't there? In fact, your school was around back then, right?
Yeah, my school, I think, just celebrated their 40th, or it's around 40 years.
It was in the 70s, I know that.
Yeah.
74 or 73 when they started. Actually,
Something
it was around the same time as my residency started. It was also in the early 70s in emergency medicine in Kansas City. Yeah, so they were around, but not widely known. And so Deborah may have worked somewhere where they didn't even have PAs because it was such a new thing.
And I think at that time it was more military related, much more so than it
Back
is
then,
now.
Yeah, because that's where it came from. Also, we have Virginia. I love watching your videos, especially on cyst and your bedside manner. Well, does that mean she doesn't like us today? Sorry. Brio, sorry, I'm the 6 knee replacement. Oh my goodness, 6 knee replacements. She'd be like a spider or insect. Was recently diagnosed with an insect with breast cancer. Happily now I'm cured. I was a matron. Oh, on Patreon she's talking about. So 6 knee replacements. There was a time when I was practicing in a place where some patients would get multiple knee replacements on the same side or hip or shoulder. And you know what happened? As soon as everybody was noticing what was going on, that orthopedic surgeon left the stage. Yeah, that was interesting. Brio, why didn't you go down the medical training to become a doctor? So we know why you didn't do nurse practitioner. Why didn't you do medical doctor, allopathic?
I never really considered that, which surprises a lot of people because for a lot of people, they start out wanting to go to medical school and then realize how much work it is and then make the switch to wanting to be a PA instead because it's so much less schooling. But I never really had the end goal of being a doctor. At some point, I think in early high school, I heard about what a PA is and what they do, and I thought, that's what I want to do. They get to do pretty much everything a doctor does. It's much less schooling. I'm going for about 2.5 years, whereas medical school takes around 8 years.
School plus residency.
Yeah, school and residency together.
Depending on the residency, yeah.
And then with that, the cost of the schooling, if you're paying for medical school that long, that adds up a lot. And PA school is still a lot of money, but much less than medical school. And then you're able to get out and start practicing much sooner. So I'll be 24 when I graduate. Whereas if I did medical school and residency, I'd be around 30 when I'm finishing. So it'll be nice to be able to start on my career much earlier in life.
30 and just starting to pay off those loans if you deferred them through residency. So you mentioned all that. So it makes me wonder, what's the pay differential between being a doctor and being a PA?
It's actually something I haven't looked into a whole lot. I know that
it's very favorable.
That what a PA makes is all that I would need to be comfortable. So I don't need anything more than that.
Yeah, as far as starting when they come out, I don't know, what is it? 3/5, sometimes 4/5, depending. It can be quite something. So we also have comment here. We already asked that. Chelsea asks. Oh, she's just saying hi from Scotland.
Oh, okay. Hi, Chelsea.
That's good. Very good. So do you know what we're doing next week? Have you heard?
I heard you mention something about Tennessee Health Department.
Yeah. I put out just a brief little blurb. I was standing in front of the Capitol of Tennessee's Capitol building, and mentioned that Michelle Fiscus, their former vaccine, director of vaccines, infectious and preventable diseases for the State Board of Health. She had been fired by the governor. And we put out that little message and we got back some comments, some, favorable for her, some not favorable. Surprisingly, so many of them have name calling in them that I took almost all of them off. There's one I left even though it has name calling in it, but just because I thought that the argument, I thought it needed to be there so that we could have a conversation, even though they, weren't being as civil as they should have. And we're going to have that conversation about them taking away the programs that promote vaccines to adolescents. They have this thing, and it might be federal, but certainly here in Tennessee at the state level, that allows for giving vaccines to what they call mature minors, the mature minor doctrine. I believe it starts around age 14 or 15, where minors are able to get certain medical care without parental consent. And we'll get more into what the arguments are, what the concerns are, what the parents want or don't want, and what the people trying to stop COVID want or don't, or measles for that matter. All right, other comments. Chelsea has a quick question. What the procedure for both leg amputation, as I could be going through it, I'm very nervous. What's the procedure for both legs amputation? Well, that's a very, 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 very serious thing. A bilateral amputation, of course, it depends on whether it's above or below the knee. We refer to the above the knee as AKA and below the knee as BKA because it's a different procedure and a whole different life afterwards. We would not be able to, at this point, give you much more information than that. It needs to be coming from the surgeon who knows why it's being done. Yeah, boy, that's huge to have to go through something like that. Oh, she already knows it's going to be an AKA. Oh, Deborah Ronker says she went to USC. How about that? Yeah. Did you apply there for your program?
I believe I started the application and didn't ever finish it.
Was that because they required something you didn't have, or?
I think I had just heard back from other schools at that point and didn't feel like
you had
the application.
In your application process, there's a lot of schools that you didn't apply to.
Right.
And part of that was you met certain requirements and you chose not to take all of organic chemistry, which not all of them require that. And so by applying when you did and the schools you applied to, you were able to get in directly out of undergrad. Are any of your friends in graduate programs that graduated with you?
Not very many. I have a friend getting her PhD, but most of my friends took a year or two off before going to grad school.
And she's in Australia?
Yes.
So you're the only one of your whole group that has a program that you're in right now in the United States?
Yes. I know there were other people in my class who went to grad school, but I wasn't very close with them and haven't kept in touch.
All right. But yeah, you're already halfway through your program as all these other people are on their second round of, or did their second round of applications, or maybe it was the first round, they just waited a whole year. And some of them probably got into things, right?
Yes.
All right. Yeah. And they're going to find out this year, others. So that would be 2 years behind you instead of just 1 year. A lot of your friends. Okay. Yeah. Chelsea also says, oh no, it's Brio replying to Chelsea because this is like a community and people can communicate. So we talked about next week. That will be at 4:30 Pacific on a Monday afternoon. And we're looking forward to that. We do encourage you to stay and watch the credits where you can see names of people like Lindsay Antwine, and some of you also have your names on there. I believe Deborah Ronker is on there also. Any questions that you have about the show? Thank you for being our guest. We appreciate that. Even with changing lighting conditions as it gets over. See, you're supposed to see right here the skyline of downtown Nashville. That we set it up that way, and then the light all changed and we lost it. It would have been a great shot, but I think we look nice. Look at us. We got this nice glow to us.
Sure.
Okay, sure. Does it look better like that? There we go. That's what we should have done the whole show. So again, thank you. Thank you, Kara, for joining us and telling us about your PA program. We'll hope to hear from you in the future. Oh, Chelsea, still talking to Brio. Until next time, Kara, Dr. Mark Vaughn telling you to stay in good health.